Prof. Renee for the informative talks and message from ASCA. Our next speaker is Dr. Dave Lee from our neighboring country, Singapore. Dr. Dave is the head of sports unit in NUH. He has special interest in knee preservation surgery with more than 50 publications. He has represented Singapore in many international societies such as ISACOS and OPCUS. Here I would like to invite Dr. Dave to present his talk on chronic buccal handle tear, how I handle it. Okay.
This session and be part of this great panel with regards to meniscus repair, meniscus tears. I've been asked to talk about chronic bucket handle tears, how I handle them. We know that bucket handle tears are large tears and they can present with locking, pain, and knee swelling. Why should we repair bucket handle tears? The resection of such large tears within concurrent ACL reconstruction results in increased pressures in the joint and would lead to accelerated arthritis. These meniscal defects, if created with resection, also affects the kinematics of the ACL deficient knee. So we need to protect the cartilage in the knee joint by repairing such large tears. We also know from the work of the MAS groups that chronic ACL tears and large meniscal lesions are associated with increased risk of high-grade laxity in pivot shifts, enlargements, and anterior drawer. Such high-grade knee laxity detected prior to surgery, prior to ACL reconstruction surgery, is predictive of a high risk of subsequent revision anterior cruciate ligament reconstruction. This is shown by the MAS group in 2018. So again, it's important to repair such large bucket handle tears to protect your ACL reconstruction. We know there are various techniques to repair the meniscus, the outside-in technique, the inside-out technique, using all inside meniscus repair devices, and more importantly, I will show in large bucket handle tears to combine such techniques to get an effective meniscal repair. Well, we show a case, a 15-year-old volleyball player with a bad landing during a game. What we can see on this MRI is a double PCL sign seen on the sagittal cut. On the coronal cut, the fragment is displaced in the notch, and this is also seen on the axial cut. This is the arthroscopy pictures. We are looking from the anterolateral portal, and we'll be working primarily from the anteromedial portal. In this case, you can see it's difficult to reduce the meniscus, even when we try to use, for example, this trocar to reduce it. It doesn't budge. So a medial release is often required. A medial pie crust is performed to open up the medial joint space. So this is the first tip we will discuss. This allows the effective and proper reduction of the meniscus. The current video shows the preparation of the periphery to aid with improve the blood supply and aid with meniscal healing. So now the devices are coming from the anterolateral portal to repair the body and posterior horn junction of the medial meniscus. You have seen 2 to 3 vertical stitches placed with all inside devices placed in the junction, and this helps to reduce the displaced fragment. Now we have placed a stitch in the posterior horn with the device coming from the medial portal. After having placed about 5 all inside stitches, we have a fairly stable repair. This is a horizontal tear repair configuration that you see that helps to secure the junction once again. However, you can see that there is still a gap in the body of the meniscus. And this will require the placement of inside-out sutures, as we have mentioned, in a hybrid repair. So after inspecting, again, we see that there is a gap in the body of the meniscus, as seen in the probing. And this is when I decided to use an inside-out suture. I placed 2 or 3 inside-out sutures to augment the all-inside sutures that have been placed. So in all, there is close to over 8 stitches placed for this unstable bucket handle tear. And then we proceed on to do the ACL. So in summary, we place more than 6 stitches. We use a combination of stitches and we use a hybrid technique. This is a second video which shows the use of an inside-out stitch to aid in the reduction of stubborn chronic tears. This is a chronic tear. You can see the rolled edges of the medial meniscus, and it is difficult to reduce it. Even if reduced, it tends to redisplace, and placing inside-out sutures using an inside-out cannula and inside-out sutures helps to keep it reduced before you place your all-inside sutures in the posterior horn. And so this is a further tip to help with and hold a reduction in a chronic tear. How do we prepare a chronic bucket handle tear? This often requires releases. You would see the release being done in the anterior interval of the knee. And so this scarring is released by a wand, and this then allows the meniscal fragment to then be moved. And again, despite trying to reduce it into the medial compartment, it does not want to move. And the other thing that can be done other than the medial pie crust is to release the scar tissue in the gutter. This is scar tissue being resected with a ablation wand. And then this can be completed or assisted with the use of a shaver. This helps to clear the scar tissue between the meniscal fragments and the periphery, and not only helps with reduction, proper reduction so that a meniscus can sit, it also helps with meniscal healing. So coming with the shaver to complete. The other final thing is that I use a cannula to aid and push the meniscus so that it can be reduced prior to placing the inside-out stitch, as seen in this video. Okay, so after clearing the scar tissue, you can see the meniscus can be reduced. This is a pre-op MRI. The above 2 images show that, and the images below show the post-op 24 months, which show good reduction and good fixation. Bucket handle tears do heal. Well, besides releases that we have talked about, it's also important to understand that a lot of these chronic bucket handles are associated with chondral lesions, as seen here. This is a large osteochondral defect, as seen on the MRI cuts on the left. And you can see that the meniscus is scarred within the notch. And the current video shows the gap between the displaced fragment and the periphery. And you see a radial ablation wand used to release the meniscus as it's scarred in the lateral compartment. And with this reduction, the meniscus is then, it is then possible to reduce it posteriorly and into the lateral compartment where it's supposed to sit. You can see that in this case, the chronicity, the tissue quality of this meniscus is very poor. And to ensure good fixation, I had to use hybrid methods of fixation, which means the use of all inside devices as well as inside out sutures. So the all inside device you saw was a flexible one that allowed it to be placed in the junction, which is sometimes difficult to reach with a conventional inside out device. And so you can see after clearance of scar tissue, reduction and fixation, we have a meniscus sitting in the periphery of the lateral compartment. Then we proceeded to fix the osteochondral fragment with a mini open approach with 2 cannulated screws. We have discussed how to use various techniques to assist with an all-inside bucket handle tear. This was published in Arthroscopy Techniques in March 2021. In summary, for bucket handle tears, we always use a slotted cannula to allow proper introduction of devices and prevent chondral damage. We use vertical stitches when the fragment is unstable with 1 stitch or 1 device in the capsule. We place stitches in the regions of the meniscus with the best tissue. It is always important to put corner stitch as shown in the picture because this prevents tear propagation. Use a combination of vertical, horizontal, oblique stitches. Try to use more than 6 stitches for bucket handle tears. And importantly, set the depth according to where you plan to introduce the device to allow sufficient distance for the device or the implants to be deployed. Otherwise, they do not sit beyond the capsule. Finally, when you are introducing the device coming from the lateral portal, be careful. If you are repairing the posterior horn, the posterior root of the lateral meniscus, this brings you closest to the posterior neurovascular structures as shown by our study published in the Arthroscopy Journal in 2020. So what are the results of bucket handle tears? Well, the results of bucket handle tear repairs range from between 80 to 85%. Even chronic tears as suggested by Santikaya, the clinical healing rates of 77 and radiological healing rates of 81. And so this is based on the evidence coming from 3 authors, one Feng Hua who used second arthroscopies. So we have fairly good results, bucket handle tear repairs. For our own series published in 2020, these are all comers. We looked at their 5-year follow-up results. We have more than 90% success for bucket handle tears. These were not only chronic tears, but as well as acute tears. So it's important to know and repair bucket handle tears because they are large tears and they protect the cartilage. So in summary, bucket handle tear repairs protect the ACL and the cartilage, ensure that you use sufficient stitches, at least 6 or more, use an inside-out reduction stitch to hold